This is Flourishing Fully Radio. Dr. Sally here. Today we're talking with Dr. Jay Davidson. We're going to be talking about Lyme disease and heavy metals. Dr. Jay is an awesome doctor. I really like his focus on holistic medicine, on natural functional medicine approach. He's an avid educator and speaker, a #1 best-selling author. I highly recommend his book. Uh, He's a husband, father, church elder, and a former radio talk show host. Dr. Jay Davidson is admired for his ability to bridge the gap between the scientific health community and the layperson. His vision to see all the details and recommend simple, straightforward instructions to his clients has gained him tremendous respect among his colleagues. An ambitious researcher and clinician in the health world, Dr. Jay's focus allows him to set lofty goals and yet attain them. Dr. Jay has a national coaching program here in the United States. Welcome, Dr. Jay.
Thanks for having me, Dr. Sally.
Dr. Jay, let's see. How did you get started in the Lyme disease world?
Well, that's a great question. I definitely didn't wake up one day and say, "Hey, Lyme disease sounds like a great topic or thing to dive into." I basically got in it out of necessity, and it all basically goes back to my wife's health history, Heather, or some people know her as Dr. Heather as well too. But that's why I've always went by first names, because if you said Dr. Davidson, we'd both turn and look at you like, "Who are you talking to?" But when she was younger, about 7 years old, she got really sick. The doctors didn't know what was going on. Giving her, running all kinds of tests, everything showing up negative, giving her medications. Next thing you know, she has brain encephalitis and goes into a coma for 6 weeks. And
Wow.
yeah, I mean, just unbelievable. And through the persistence really of her mother, they tested for Lyme, and this was 26 years ago, 27 years ago. So this is obviously a while ago, and before really Lyme has even now, it still's got some more work to do to become more mainstream, but it's definitely a lot more now than it was then. And they ran a test that actually showed up positive, the old style test, which is very inaccurate, but a godsend in her case, where it actually showed up positive. And what was interesting about my wife's story and all this with Lyme disease at such a young age is that they never found a tick bite, and she never had a bullseye rash. And those are kind of the quote-unquote things for Lyme. And, they say only about 30% of people actually get a bullseye rash. So I think Lyme is one of those things, like as a clinician, I say if you have anything weird going on, anything mysterious, I got to make sure it's not Lyme, or Lyme is not, a piece of that. And basically from that point forward, when she was 7 and she got sick, they gave her intravenous IV antibiotics for, a couple of years, and then oral antibiotics. And, if the antibiotics were really the fix for her, she wouldn't have had health issues that kept going. And I've been with my wife now since 2004, so we're looking at about 12 years roughly I've known her. And in that time frame, I've seen the struggles that it's created. And basically from that, that's where my passion has really come from. Almost to some degree a little selfish, and to figure out, okay, what does my wife need to do to get her health back? Because I've seen glimpses of it here and there. But when my daughter was born a few years ago, a little over 3.5 years ago, my wife almost died. And it was that point that we said, you know what, we really, really got to figure this out. We can't just get by. And I'm sure you have people on your podcast that are listening where, there's health issues going on, but they don't want to stir the pot. They don't want to get worse, so they just kind of keep getting by. And that's where my wife had been. She had been through a couple heart surgeries. She had her sinuses scraped. She had, vertigo so bad she had to basically sit propped up vertical for about 6 months because she couldn't lay down. The room would spin. I mean, you name it, she's been through it. And, it all of that really has led me into the Lyme world to work on trying to put the pieces together. Because as you know, Dr. Sally, Lyme is complex, and it's probably one of the most complex things that's out there.
Well, you're a real hero, Dr. J, supporting this beautiful woman in her journey. with a really devastating Lyme experience.
Yeah, well, you have your own experience, Dr. Sally. So, yeah, you know firsthand that, it's these stories, these things that we've been through that really alter the path that we're on.
Well, you're quite amazing, and I honor your dedication to helping people with chronic illness and Lyme. That was stimulated by your wife's illness. But what do you do if you have a client who's got all these weird symptoms and they test negative? As a matter of fact, which test do you recommend?
Yeah, well, the testing, that's a great question because Lyme testing, very inaccurate. The standard is the ELISA with Western blot. They call it a two-tiered method. But when you're actually looking at research, it's anywhere between 30 to 50% inaccurate, or it's accurate 30 out of the 50%. 30 to 50% of the time it's accurate, meaning that it can be even worse than a coin flip. So I definitely never recommend the standard testing that's out there, the ELISA with the Western blot. And that, when you look back in history, that all came from simply that they used it as a way of an observational method for Lyme, and somehow it got into the diagnostic category, and it's been the staple ever since. So I think it's definitely a big mistake. There's other companies like IGeneX that do more expanded versions of the Western blot, and I have a respect for IGeneX, but I don't personally use them. I'll have people come to me with testing done. My favorite, and it's been out for probably about 3 years now, a little over 3 years. This specific one, they've had some previous ones, but there's a lab company called Pharmacin Labs, and they're based out of Wisconsin, where I'm actually located, a hot zone for ticks as well as the Northeast. But I mean, they're all over.
Can you spell that, Pharmacin?
Yeah, it's Pharmacin. It's PHARM. So it's farm with a PH, and then I believe it's SEN. So Pharmacin Labs, or SAN, Pharmacin Labs. But they have a test. They had a previous one, and then they revamped it, and I like it even more now. It's called iSpot. So it's like iPhone, like the letter I, but it's spot. So it's lowercase I and then spot. iSpot Lyme test. And it basically works off the same principles that like a TB test would. And obviously the TB test is well accepted in the medical world. So I fully believe, when we're looking at not only right now, but in 5-10 years, clearly something has to change with testing, because it's wide known that testing is a problem, the accuracy for Lyme disease in America. And I believe, based on what I see now, the iSpot Lyme is going to become that gold standard. And they already have co-infection ability. They're just waiting for the CDC approval to get a hold of that, or to basically approve them of it. So I believe the iSpot, along with the co-infection that they use, where they're checking, instead of B cell antibodies, they're checking T cell. I think that's really the way of the future. And I love that test, Dr. Sally, because it doesn't just, and it's not the end all. I'll say, as a clinician, you have to look at symptoms. I mean, anything weird, you got to rule Lyme out. And until you can rule it out, I think to some degree, you always have to go after it, especially in the crazier the cases are. But I like to utilize this test along with history, along with symptomatology and examination. But the iSpot Lyme will not only tell you, is it negative, positive, or in the middle, the equivocal, but it'll actually give you a number. And so I'll give you an example of this. So when you look at a test of iSpot Lyme, and I don't work for the company, I just really like their test. I probably sound like I'm a rep or something, but I love the tests. Have a lot of
No, it's important to find something that works.
Yeah, definitely. And so when you're looking at a test, you'll see over 25 is positive, under 17 is negative, and then in the middle is the kind of unknown territory, the equivocal. And what I'll say is, if you get somebody that's 25 versus you get somebody that's 88, even though they're both positive for Lyme disease, those are two different numbers. And I've had a lot of, it's a blessing, to work with a lot of Lyme clients and patients and people that are struggling with health issues, because I've had a chance to run a lot of these tests. And I had a patient that ran a test, and she was over 400. And over 400 was like the max a lab could even comprehend. And the head of the lab actually called me and asked what is going on with this person, because it's February in Wisconsin. It's super cold. This shouldn't even be tick season. What made you even suspect somebody had Lyme? And this particular client, she recently had a baby, and she was found underneath the stairwell holding her baby with a knife because she thought people were coming after her.
Oh, wow.
So in this amazing, psychiatric, unstable brain state, where I've had other people, they'd come up as a 25, and what my interpretation is, the higher the number, the more acute, the more Lyme plays a role. The lower the number, the less Lyme's a factor. So another good example is my wife. So after she gave birth to our daughter, and there was many sleepless nights. There was nights I laid in bed just wondering, is my wife going to wake up in the morning? It had gotten just so bad. And I'm like, how am I going to raise, a daughter all by myself? First child, all new to this whole world. And, obviously, luckily, she made it through, survived, and, we gleaned so much insight from that, experience. But we had ran the iSpot Lyme test after she gave birth to my daughter and really hit a wall right when that test first came available, and she came up as an 88. So over 25 is positive, 88 is in the acute phase, like it's active. And of course, all kinds of nightmares, mental stresses came about Dr. Sally, because she had been, diagnosed with Lyme 20 some years ago, and now it was back with a vengeance. And that was really the turning point that, we put the pieces of the puzzle together. We identified there was pieces in her history we hadn't dealt with, like heavy metal toxicity, autoimmune thyroid. There was digestive issues that still lingered. Obviously, the mental mind state, as you know, plays such an important role, but along with the actual, bacteria, the Borrelia, but along with, co-infections. And so, really putting that together, looking back, we reran the test, and it was May of 2014 that we reran the test. And she not only came up as a negative, but she was actually a 0.
Oh, great.
And, so kind of long story short, I love the iSpot because it can track where somebody is at, and give us more direction into that.
Do you think it's important to know which co-infections you have, or you just treat it like a soup? And what's your take?
It's a great question. There's so many different testing methods to try to identify what co-infections, like IGeneX has them, Pharmacin Labs are going to come out with them. But to some degree, when you look at Lyme disease, to get somebody well with Lyme, you have to look at the body as a whole. You have to deal with the whole thing. You can't just try to kill the bug. And one of the things that I've found in the clinical side of it is, as you're peeling the layers of the onion back, and let's say the onion is you getting, to the core of the onion is health. As you're peeling the layers back of issues and problems that you're having, conditions, sources of the problems, of course there's going to be some tears along the way, maybe with each layer as you're going through it, you're retracing your healing. But what I have found is that there's times where co-infections like Babesia, Bartonella, Ehrlichia, Mycoplasma, there's a whole host of them, but there's times where co-infections seem to be running the gamut, and a lot of times you can look at symptomatology. Does somebody have more achy joints, or does somebody have more neurologic brain issues, and kind of be keyed in on, okay, it's a specific maybe co-infection that might be taking hold. But what I've seen and what I've noticed clinically is that you can go after a co-infection like, let's say, Babesia, and classically in the Lyme world, people will say, well, when you go after a Babesia co-infection and you have it, you'll get herxine, so you'll know that this is working. But in the clinical side, that I see is if you go after Babesia and you don't notice anything, it doesn't mean you don't have Babesia. It just means that there's probably other things that are at the forefront, whether it's Lyme or a different co-infection. And then as you kind of beat that down or kill that off, or, per se, going back to my analogy of peel the layer back, then that opens you up to another layer. And in that other layer might be Babesia where it wasn't in the first. So I think from a clinical side, I think people get ruled in and out of co-infections too fast, when I think it needs to be more integrated into the protocol on a regular basis, because the body, different bugs come up at different times and they recruit others. And so when you take one down, then it's like another one comes up and takes hold. In the scientific world, they call it quorum sensing, but that's just what I notice from a clinical end.
Do you treat your clients differently according to the different co-infections that they have?
Yes. So depending on symptomatology and presentation, definitely, everybody is different. This is why, from a clinical side, I work with limited number of people just because it's very, individualized. I think cookie cutters are great for baking, but definitely not for, the
good analogy.
The health world. Not that I would necessarily use a cookie cutter as well, because then you're eating like grains and breads, but I guess that's beside the point. But no, everybody's individualized. And when I look at somebody, for instance, with Lyme disease, I'm looking at everything. So I'm looking at the gut, I'm looking at adrenal, thyroid function, hormone levels, and it's really easy to spend a lot of money on testing, and I love to look at test results. But I'm not a huge fan of somebody spending $1,000 just to run, the whole gamut of tests on everybody. So I really like to do an assessment visit, and from that assessment visit, figure out, okay, are there tests that need to be run? Is there heavy metal toxicity? Which metals, what levels? Because, higher in lead versus higher in mercury levels is different, detoxification protocols. And then when you throw Lyme into it, what's the eye spot Lyme telling me? What's the number? Is it high? Is it low? And then based on that, along with other, the other comprehensive look at the body, then I'm able to identify, okay, I think this is the main culprit. So let's go after this, but let's also help with symptoms along the way. Because as you know, with your own story, Dr. Sally, when you're not sleeping, life is miserable. The body can't heal. So I always look at two pieces. I look at managing symptoms, but the most important thing that I think as a clinician that we can look at is looking at the source. How do you get to the source and heal the source? Because that's what's going to get the body well, and that's what's going to allow that individual to not have to rely on doctors for the rest of their lives. And I really view my role as a health coach as, I want to teach somebody what they need to do to get their life back and health back. Not only which pieces of the puzzle to put together, but in what order. And then from there, they can continue to work and build. Because, Rome wasn't built in a day, and it definitely, health doesn't come back to you in a day. It takes some time.
Right, and it took a while. Usually, it takes a while to get as bad as you're going to get. Although some people get hit pretty hard, pretty quickly.
Yes.
So you're concerned a lot with heavy metals.
Yeah, I see. So, like, going back to my wife's story, looking at what might have been a big turning point, because I'll get asked this a lot. It's like, well, how does she go from, and I'm sure you get the same questions, Dr. Sally, but it's like, how do you go from, being on your deathbed to now being the healthiest you've ever been? And I think, of course, putting all the pieces together was a big piece of it, but heavy metal toxicity was something that I was exposed to, the idea, the concept of it, and testing back in, I think it was 2006, maybe 2007, somewhere around that time frame. And my wife had tested on the higher end for mercury and lead, outside the limit and like, toxic level. And I went through the same testing because I'm very curious. I'm like, well, if she's got heavy metals, I want to get tested too. And I actually came up almost the same range, which was very interesting. And we went through a detoxification protocol with DMSA through a practitioner. And we both started having some reactions, kind of got itchy, rashy, like just uncomfortable, like couldn't even stand it. And through talking with the practitioner, they really didn't have answers. And so we ended up just stopping, and we're like, well, we obviously can't do this, or this isn't right, or something's wrong with it. And then we were down in Florida visiting a practitioner for my wife, looking to get her well. And that practitioner said, "Oh, you tried DMSA. Why don't you try DMPS, which is sold typically under the name like Mercout?" And so we tried that, but my wife was a little hesitant. So she's like, "Jay, you try that first, and let's see how it goes." Well, I started on it. The next thing you know, my face got inflamed, itchy, rashy. It was hard to breathe. My lips puffed up. Like I literally couldn't even stand my body. I just like this. I'm just in this horrific state. And my wife calls the doctor, and she really wasn't didn't really know what to do. So she ended up calling the quote unquote DMPS expert in New Zealand. And that doctor also didn't really have recommendations for me. And they ended up coming back, Dr. Sally, and they said, "Well, if it gets really bad, go in the emergency room, but maybe you want to try an oatmeal bath to, just to try to calm the reaction down." And at that point, it was, I wouldn't say I was near death where my wife was, but it definitely felt in the moment like it was really bad. And at that point, my wife and I made a decision that, you know what? If we do have heavy metals, there's just no way to safely get them out of the body. And so we kind of dismissed it. And then years later, learning more about heavy metals and kept coming back to it. It's like the things that we know are a big issue that we have to, that we keep coming back to. It's like, God putting a stronger signal on us, or, like ringing the bell louder and louder until we listen. And I heard
Absolutely.
And I heard a practitioner talk about heavy metal toxicity and talk about understanding how to prep the body, how to prepare it, how to work with it, how it, and it opened my eyes up and said, okay, I got to figure this out. I got to do more research. And come to find out, when you look at heavy metal toxicity, there's true chelators and then there's not true chelators. And I always like to use true chelator, something that's going to grab on to the heavy metals and pull them out. But depending on the type of metal somebody has is going to dictate the type of protocol. Depending on somebody's body, whether somebody's a fast metabolizer or a slow metabolizer, whether they have gut issues or not, is going to dictate how they do with heavy metal chelation, or really heavy metal removal. And so we basically went down the route after my wife was on her deathbed, and we said, okay, we got to get you well. We got to get you healthy. And we knew heavy metals was that one daunting thing in our face. So spent countless hours researching, putting this all together, and basically, through almost some experimentation a little bit with her, because it was so new and just didn't seem like many people, if any experts, had really put all the pieces together, walked her back. And it was through heavy metal removal chelation that seemed to be the light bulb for my wife. And when I look at Lyme disease and heavy metals and how do they fit in, there's a thing called biofilm, which I'm sure you're familiar with, Dr. Sally.
Yes.
There's a thing, biofilm, which I always like to think of it as like a blanket that gets put over top of a bunch of pathogens. And then when you remove the blanket, then your immune system can go after the pathogens. But when the blanket is there, or the biofilm is there, then your immune system can't access it. So it means you can never truly get well of Lyme disease if Lyme is hidden in biofilm. And some people like to call it like, sticky snot, or, other analogies, but I just always think of it as the blanket. And when you look at research with a biofilm, biofilms are made of different material. But some of the biofilms have material like calcium, magnesium, iron, copper, and other trace minerals. But a couple ingredients that really stood out to me in my research was mercury and lead. Meaning that the heavy metals, mercury and lead, are part of the ingredients of a biofilm. So when I took a step back and I said, okay, if part of the material of the biofilm, the blanket of what covers up the Lyme bacteria, is made out of mercury and lead, then it would only make sense that if you have mercury and lead issues, that's going to be a material in biofilm, that you would have to chelate, remove that to really get down into the deep pockets of that pathogen. And so that's the best explanation I can really give as to why heavy metals seem to be such a big impact for my wife. And I would say on the clinical end, now coaching people for, probably 3 years, I basically, as soon as people started finding out her struggling and getting her health back, it's like, people started coming to me looking for answers as well too. And I've seen this on the clinical side that a lot of the quote unquote Lymies have heavy metal toxicity issues, and to truly get to the Lyme, you have to basically remove heavy metals.
Right. Can you back up a second and just tell us what happened with your experience with the oatmeal bath? Did that reverse it? What happened?
Yeah, so it was at that state. Everything was horrific. I even put the book that I wrote, the 5 Steps to Restoring Health Protocol. I actually put pictures in there. And I remember my wife taking those pictures. I'm like, don't take pictures. She's like, I'm taking pictures. And now looking back, I'm like, I'm glad you took pictures, obviously to show other people. But in that state, honestly, I had a hard time even getting in the bathtub. I was so uncomfortably hot, cold. I literally was, I think, under the sheets naked with like shivering, but couldn't. It was such a crazy state. And honestly, I just sat in bed miserable for a few days before my body started to kind of calm down. And it took a while after that, but it took definitely a few days before I could actually be up and actually doing something. And I don't even think I did the oatmeal bath because I think I put my foot in the water and I was like, nope, can't even. This is too shocking to my body.
Wow, that was really powerful. So it's just time.
Yeah, it was just waiting it out, and it was miserable. I don't want anybody to go through that like I went through.
Your specialty is using detoxification methods for the heavy metals, would you say?
Yeah, I love to utilize true chelators for heavy metal chelation. When you look at heavy metal detoxifying, though, it's very easy to say, oh, I want to get tested for mercury and lead and then begin detoxing. But when I look at my past history, the practitioners that I had went to didn't quite understand what's called half-life, or like the pharmacokinetics of how your body processes things. Didn't understand half-life. It didn't understand identifying, whether somebody's a fast or slow metabolizer, and then how to alter protocols based on that. Also, but besides that, I think the bigger thing is I never did anything to prep my body to get ready for it. And heavy metal detoxing is hard in the body. The metals are being stored. Like mercury has a high affinity for the brain, lead has a high affinity for the bone. The body has these metals stored in it because they're dangerous when they're out floating around. So they're basically stored in different areas. And when the body releases them, it causes stress to the body. But as in the words of the scientific movie Shrek, he always talks about, it's always better out than in, and that's absolutely true. But you got to make sure it's safe coming out. And I think the missing link one of the main missing links that I had issues with is I never went through anything preparatory. So preparing, for instance, your digestive tract, preparing your liver and kidneys for the stress that's going to come from removal. And it's as long as somebody's guiding you, with the protocols and understands things, it's very safe. But as I experience, it can be dangerous when, you don't know those steps. And so I definitely love, true chelators. True chelators would fall into the classification. There's a thing called a thiol group, which is basically just like a sulfur and a hydrogen that's attached to a molecule. And a double thiol group would be a sulfur hydrogen right next to each other. And it forms basically like a claw. And that's, when you look at the Greek word chelate, it basically means to claw. So true chelator would be DMSA, EDTA, DMPS, ALA, or alpha lipoic acid. Those are some true chelators. So I like to utilize true chelators along with other things. So I think an important piece that gets missed in the heavy metal detoxification, besides using a true chelator with half-life and kind of cycling on and off, and then besides the whole preparatory, getting the body ready for it, is also utilizing something that helps to increase glutathione.
Let me just back up. Which one of those chelators is the best? or it depends on the individual?
Yeah, that's a great question. DMSA, for instance, is awesome at pulling lead out of the body. EDTA is amazing at pulling lead out of the bone, but it's not really good to pull it out of the body. So I've definitely had, unfortunately, too many clients come to me that have done IV EDTA chelation and have basically had their lives destroyed because they pulled the lead out of the bone, but they didn't do anything to get it out of the body. So, but there's definitely a time and place for EDTA. DMPS is amazing for mercury out of the body. But even those three, the DMSA, the EDTA, the DMPS, they're not what they would call fat-soluble chelators, so they don't actually cross the blood-brain barrier. And with somebody with mercury issues, whether you've been vaccinated or you have the silver amalgam mercury fillings in your teeth, if you have even one filling, we know there's mercury in your brain. And science shows the more fillings in your mouth, the more mercury in your brain. Basically, if it's the amalgam silver fillings, which are 50% weight mercury. But ALA, which is very inexpensive, is actually a fat-soluble chelator. So ALA is amazing for mercury in the brain. So I like them all, but I think it really depends on the heavy metal issues somebody's going through, and also doing the right phase. So when you're looking at, for instance, like chelating heavy metals, you want to empty the body tissues first before you start trying to chelate mercury out of the brain, because if there's more mercury in the body tissues than the brain, and you open up that brain to body connection too soon, you could potentially form a concentration gradient to go into the brain rather than out of the brain. So I think there's a time and place for all of them. When you look at my history, I reacted to DMSA and DMPS. But I'm here to say that once my wife, after she hit rock bottom and we began this heavy metal, removal and chelation process and looking at it, I went through it with her. And I went 2 years of chelating with DMSA, ALA, and had no issues, not one time, even though I reacted and almost died before like DMPS and reacted to DMSA. So, it's interesting when you look at all the stuff that's available.
Yeah, and that's a cautionary note that people should not initiate this therapy on its own, that they have very powerful effects on the body, and they need to do it under supervision. Wouldn't you agree?
Absolutely. Yeah, I think it's definitely a topic, to do more research on and get educated, but you got to have somebody help you. There's just too many intricacies and not only understand the heavy metal protocols, but really just what do you need individualized to get the body ready for it, and then what are the other sources of issues to go upstream to truly get the body well.
Do you consider that chlorella and spirulina are helpful in the detox process that you're addressing?
That's actually a great question. Those will be thrown out there as chelators, and my personal opinion is I don't believe they're true chelators. Now, when you look at chlorella, cilantro, the spirulinas, especially the chlorella and cilantro get talked about a lot. Those have a sulfur hydrogen group on them, but they don't have a double thiol group, so they have a single one. And a lot of the studies, when you look at them, they talk about their in vitro studies, which in vitro studies just means in a petri dish. So they put mercury and chlorella together in a petri dish and it binds it. I think it's different when you have something binding in a petri dish versus more of what they would in the scientific world called in vivo, where it's actually binding in the body and pulling it out. And so I definitely, it's interesting because we keep learning more about this, and this is very cutting edge right now. It's a great question, Dr. Sally. It's chlorella and cilantro are not true chelators, and I've only seen people get worse by using them. But I'll say this. What I found is that those people that are having really rough times heavy metal chelating, and they just can't, especially the people that have like liver issues, while you're on a true heavy metal chelator, integrating a chlorella and a cilantro seems to help stir metals up so that the true chelators can grab onto them and pull them out. So I think the chlorella cilantro from a clinician standpoint, clinical standpoint, seems to stir metals up more than its ability to pull them out of the body. So I personally don't like them by themselves, but I think there's definitely a clinical piece to that puzzle.
Right. So you started to talk about glutathione. Could you go back to that?
Yeah. So glutathione, big word, but it's the strongest antioxidant in the body. It's actually made naturally by our body. And, when you're looking at research, basically people with cancer, people on the autism spectrum, they have low glutathione versus the average American. A healthy American, healthier than average American, would have higher glutathione. So potentially you could kind of use glutathione as a level as somebody's health. You have high, low, or in the middle. And glutathione, it actually has 2 sulfur hydrogen groups on it, but they're not right next to each other. So glutathione's technically not a true chelator, but it is a very strong detoxifier of the body. It's made of 3 amino acids: cysteine, glutamic acid, and glycine. It's usually cysteine that's kind of that rate limiting. So taking things like grass-fed whey protein or a popular supplement like N-acetylcysteine usually helps with glutathione production in the body. And the thing that I found with glutathione is a great, because it's such a strong antioxidant, glutathione is a great protector of the body while you're using true chelators and while you're detoxifying. So I love glutathione. There's a lot of different forms though. Oral, just you can take glutathione all by itself. IV glutathione, and then there's kind of the precursor category of glutathione that helps raise that up.
What's the precursor that we can take?
I mean, there's quite a few things that are precursors. So, like when you're looking at glutathione, like I said, it's a tripeptide, so it needs those 3 amino acids. Cysteine's usually that rate limiting. So if you do anything to really increase cysteine, you're most likely taking what we'd call a precursor to increase glutathione. So like a supplement like N-acetylcysteine could do that. Whey protein, like I mentioned, has cysteine in it. A lot of our food actually doesn't have cysteine. So that's why a lot of researchers believe that's kind of that rate limiting factor. But even though the body can manufacture glutathione, and it does require quite a bit of energy, as you probably already know, being the mitochondrial expert around here, Dr. Sally. But it takes about 3 ATPs to make one glutathione molecule. So looking at glutathione production, it's quite, from an energy standpoint, costly to the body. So there's another way that the body can actually utilize glutathione. If I break it down, there's 2 forms of glutathione. There's the reduced form called GSH, and then once GSH gets used, the reduced form, it can turn into the oxidized form, and the initials for that are GSSG. So the only reason I'm saying that is there's certain compounds like selenium, alpha lipoic acid, actually the ALA that I mentioned earlier, cordyceps, even milk thistle. These ingredients will actually help to recycle. Once glutathione goes from its reduced, your GSH, to your GSSG, there's some compounds that can actually help recycle from GSSG back into the reduced form, and it's actually more cost effective for the body to recycle the glutathione than just purely manufacture from scratch. So when you're looking at glutathione, I think definitely precursors is an important thing, along with addressing the piece that of actually recycling the used up glutathione back to the active. It's really more oxidized to reduce, but utilizing the recycling method along with the production method, I think is people's best chances with having help from glutathione.
Is there a single best type of glutathione?
So talking about the different types, oral, you can actually take straight glutathione, but it doesn't pass the gut barrier well at all. So the gut pretty much digests it. So taking just straight glutathione's really not good. There is more recent ability now to make liposomal form of glutathione, which means they encased it in fat, each molecule encased in fat, and that actually gets absorbed into the gut as well. There's acetyl form of glutathione, so you can take more of a straight glutathione like a liposomal or acetyl, and that can help. IV chelation, or not IV chelation, but IV form of glutathione, people usually feel amazing the first month or two, but typically have a crash. And what I think happens from a chemistry standpoint is you inject glutathione in the body, and that goes active and starts working. But when you inject it in the body, it doesn't necessarily mean that the glutathione is getting inside the cell. So I think you have a lot of glutathione on the outside of the cell doing its magic, and then after a couple months, because glutathione hasn't penetrated the cell membrane and got in at the cellular level, I think people crash. So I think IV glutathione could be used maybe initially, but definitely not long term. I think oral glutathione, maybe the liposomal form or acetyl form, can be used, but I definitely like more of the things like precursors and the whey proteins and supplements that would have more focused on the precursors, along with compounds that can help recycle it. Or maybe the best bet is doing a variety of that. I don't truly know, just what I see from a clinical side.
Right. Well, those are all good points. So, Dr. J, what do you take on a daily basis? What's your daily regimen?
I'm a big fan, actually, of changing things up. So I don't like people to take the same thing for their lifetime. It's actually a really good question. It brings up a whole new topic. So, one thing I find, for instance, is like somebody will, the common things is a multivitamin, a fish oil, and a probiotic, maybe vitamin D. And I totally can see the vitamin D, especially if you live in the northern, U.S., basically, unless you're in this, southern half of Florida, you're going to, I'd recommend taking vitamin D. But when you look at like fish oil and probiotics, it seems as if we get stuck in one kind. And a probiotic capsule maybe will have 8, 12, 20 different strains, but they're the same strains. And I think when we overconsume one thing, we can actually push bacteria out of balance. Even if it's good bacteria, we can push it out of balance because we're missing who knows how many other thousands or, hundreds of thousands of other bacteria are in our gut. I mean, we're still trying to document, all the bacteria. So I like rotational. Same thing in the fat category, like fish oil. I like to rotate different kinds of quote unquote fish oils. I love taking more of like a 4-to-1 ratio, omega 6-to-3 ratio oil that's good for brain and cell membrane. I like taking the EPA DHA fish oil at times too. I think there's not anything I get stuck into. I like to rotate because I feel like the body does best with that. And it seems, when I look at the big scheme of things, Dr. said, it seems more effective, or maybe not. Well, I would say it's more effective, at least in my opinion, but it seems more natural to do that too. If you look at like seasonal eating, for instance, there's certain foods available at certain times,
Sure.
or certain famines, those kind of things. Rather than being stuck, for instance, in one way of eating, one diet, one thing you do every day, or one way of supplement, I really think there's times and periods where, for instance, let's say somebody's really struggling with Lyme disease. Well, the first thing you got to open up is that draining pathway. You got to make sure things are flowing. You can never, look to eliminate or kill pathogens until the body has that draining pathogen or draining pathway open. So I think I really like kind of looking at phases or focuses, right? So maybe focus on gut health, focus on liver health, focus on drainage pathways like the lymphatic system, kidneys, maybe liver, colon thrown in there. I like focusing on heavy metal chelation. I love focusing on more pathogen purge and rotation. I always like to kind of keep things on their toes, I guess is probably the best way to say it.
Right. Well, you've given us so much information. Your dedication, your personal experience, your passion just has led to an incredible approach to beating the beast of chronic diseases and Lyme. I want to thank you so much. I want to tell our readers to make sure and look out, buy Dr. J. Davidson's 5 Steps to Restoring Health Protocol. It's an awesome book. Dr. J, I want to thank you for participating with us today. And I also want to add this disclaimer that all information and results on this podcast are for informational purposes only. The information is not specific medical advice for any individual. The content of this podcast should not substitute for medical advice from a health professional. If you have a health problem, speak with your doctor or a health professional immediately about your condition. That's important to know, but also it's important, I think, and I hope Dr. J would agree, to think outside the box. You know, most physicians today aren't that familiar with heavy metals, and the best approach to getting them out of our bodies. So, Dr. J, thank you so much.
Oh,
and,
it's been a pleasure, Dr. Sally.
You and Dr. Heather are an inspiration to us and to all the folks listening. And where can they find you on the web?
Real easy. Just my name. So drjdavidson.com. DRJAY and then Davidson. Like Harley Davidson, just unfortunately no relationship to that Davidson. So drjdavidson.com.
God bless to all, and thank you.